A very old man, about 65 years. He was living his life very peacefully, alone. He has only one son who is working in the army. One day, suddenly this old man gets some chest pain, so he visits the hospital nearby. In the hospital, his condition worsens, the pain worsens, and it was diagnosed as heart attack. Very severe heart attack. He was immediately admitted in the ICU and the necessary treatment was started immediately. But the heart attack was massive and even the old man was starting to faint. So during this time, the old man asked the treating nurse to call his son from the army because he gets an intuition that he is going to die. Before he dies, he wants to see his son. So the nurse also says, yes sir, I will definitely help you, and she immediately informs the hospital authorities and they give the information to his son in the army. His son was working unfortunately about 3000 kilometers away, so it took almost more than 24 hours to come back to his hometown and come to the hospital. By the time the son reaches the hospital, the condition of the old man really worsens further. So he was entering the hospital in the evening time around 7 to 8 p.m. And the nurse sees him, asks him, who are you? I am his son. I have come here to see my father, he tells. So the nurse takes him to the old man's bed, and the old man was not in a condition to actually recognize his son. But the nurse tells him that, sir, your son has come, as per your request, your son has come, open your eyes, open your eyes. The old man was highly sedated because of the unbearable pain of the heart attack. But slowly he opened his eyes, but partially only he was able to open. Seeing his son, he extends his arm towards his son. The son holds the arm of the old man. And the nurse sees this, and she brings a chair and puts it near the bed of the old man. So the son, holding the hand of the old man, sits there comforting his father. He is telling few words, he is telling positive words, but he is not talking at length. But his father is unable to speak. He is just peacefully closing his eyes and lying on the bed. But from the monitor, everybody was able to see that the old man is actually going to die. His condition is worsening and worsening and worsening. So the son sits there holding his hands. It is 9 o'clock in the night, then 10 o'clock in the night, then 11 o'clock in the night. Seeing this, the nurse comes to the son and tells, sir, you please go and take rest. We will take care of him. We are in night duty only. But the son says, no, I will not move from this place. I will manage myself. You please take care. I will hold my father's hand. And he asks the nurse to go away, and he just sits there patiently. Nothing seems to interrupt this son actually. The environment of the hospital, the busy environment, the nearby beds, patients, they are groaning in pain. The alarm is constantly ringing. The phone is constantly ringing. The ICU environment is always busy, even in the night time. But nothing seems to affect this son. He is just holding his father's hand and sitting there patiently. The time is moving, 12 a.m., 1 a.m., middle of the night, 2 a.m., 3 a.m. He doesn't seem to move away from his father. By early morning, 4 o'clock, actually the father dies. The monitor seems to stop. So the son immediately informs the nurse. Nurse comes and checks and confirms that the father has indeed died. So then she completes the formalities. She removes the oxygen and everything, and she did some formalities. And then she comes back to the son, and she wanted to comfort him by telling some comforting words. So she comes near the son, and the son asks, who is this man? The nurse just gets surprised. He's your father, she says. No, he is not my father. Actually, some confusion has happened. By the time I reached the bed, I realized that this man is going to die. But at the same time, I am not his son. But he is unable to recognize I am his son or not. So I thought better let me sit with him and comfort him, because his medical condition looks like he is going to die and it is his last minutes. So somebody should be there nearby. That is why I sat near the man. You please inform the real son, he says. So this is humanity, this is life, this is love and affection. In these modern days, the elderly people are kept separate from their sons during the old age. What a old man will need is only the presence of his son or daughter, just the comforting words. That's all they need, their presence, nothing else. But most of the societies around the world tend to neglect or isolate the elderly people away, which is pathetic and sad. By the time the old man or old woman is unable to take care of themselves, then the role of son or daughter will start. Definitely they should be nearby their father or mother and they should take care of them. That is the moral of this story. Ultimately, it is the love and affection that will speak about our presence during this short tenure in this world. I hope you like this video. Kindly share this video with all your friends and relatives. Meet you all in the next video. Until then, goodbye from Dr. Karthikeyan. Thank you.